Hello and welcome to Puberty and Neurodiversity by Space Hertfordshire, with special thanks to Dr. Mark Brown at Special Help for Special Needs. My name is Chris Russell and I will be delivering this webinar. The first thing to consider is that puberty happens whether we like it or not. As parent and carers, it is inevitable that our children will go through puberty. So this is a topic that we're all going to have to get used to. We're all going to have to talk about, learn about, and support our children with, whether we're prepared or not. So puberty is an inevitable part of your child's journey, whether we choose to embrace that or not. Puberty is not something that we can avoid. Our children are all moving towards puberty, and taking the time to prepare for those changes is a vital part of supporting any neurodivergent child through a time of huge change and huge transitions. Eventually, as parents and carers, we will navigate supporting our children and addressing puberty-related questions and sexual concerns. You have to support your child and deal with puberty too. You are involved in your child's puberty. So this involvement can be a positive, direct approach, or we can do it indirectly, often with more negative outcomes for your child. If you choose to tackle and address puberty head on, then you're going to have a positive impact on your child's development. So some quick puberty facts. Autistic children will go through puberty. Children with ADHD go through puberty. Children with learning disabilities go through puberty. Children with hidden disabilities, children with profound and multiple learning difficulties will go through puberty. Being neurodiverse or disabled does not stop you from being a human being that will go through that natural change of puberty. So what happens during puberty? Well, firstly, behavioural expectations change. Some behaviours that might be quite cute, quite childlike in your child's earlier years can suddenly and quite rapidly become inappropriate. So your child tickles the lady's knees in front of you at the queue at Tesco. It's absolutely fine when your child's 4, oh, sorry about that. When your child's 14 and does that, suddenly it has a very different meaning to that behaviour. Telling people they have lovely hair, talking about the changes in their body. Oh, my shoe size has gone up. I've got bigger feet now. We can tell strangers that you've got bigger feet. But suddenly, if your breasts or your penis change, are those body changes okay to talk to strangers about? Suddenly not. But to some children, some neurodivergent children, they may just be another body part. Well, I can tell people that I've got bigger shoes. Why can't I tell people that I've got bigger breasts or a bigger penis? Suddenly those behavioural expectations, that language change happens very quickly, often overnight. And those sorts of conversations can be embarrassing for some parents and carers. But it's going to be frustrating for your child to not know the social rules that have changed. Because puberty and sex are not topics that we openly discuss, especially in public. And not all concerning behaviour that we've talked about so far is deviant, but can often be a result of children being uninformed and unaware. So more informed is less vulnerable. So when your child goes through puberty, you don't have to learn brand new parenting. It's not brand new parenting, but it's an extension of the support and teaching that your child has already been receiving throughout their life. That includes age-appropriate clothing, age-appropriate hygiene. It's an extension of that, but it's not brand new. And as a parent, if you are informed, you will have an informed child, because informed parents inform informed children. So as part of puberty, we need to prepare our children and we need to prepare ourselves for your children going through those changes. So as a parent, our role is to ascertain what is being taught at school. So I know what my child is getting from school, what gaps may they have. May I need to extend upon and differentiate what's being taught in school. And I need to be aware that my child will be navigating their own sexuality during puberty. And how would I expect a neurodiverse child to manage their sexuality if they had no sex education, If they couldn't ask or talk to anyone and don't have access to books or other visual or written material, often it would be down to us as parent carers to provide that place for conversation, that place for information. We need to ascertain what topics are we embarrassed about and be prepared to have those conversations. So let's talk about the changes about puberty. Size. Children grow much more rapidly during puberty. Strength goes up with those hormonal changes as well. Along often comes strength. Suddenly, when your child starts play fighting, it was fine when they were small. That was an acceptable game to play. But now they are much bigger and stronger. The child may not know their own strength. They may get quite frustrated or upset if they hurt somebody when they're just trying to play. It can be a very confusing time. Your coordination. For many neurodivergent children, they may have proprioceptive differences in the brain. Those that are dyspraxic as well, that coordination may not come as naturally. But your coordination, your body coordination, changes throughout puberty. Suddenly your body's in a different place to where it used to be. Your head is much higher up. Your shoulders are much wider than you're used to them being. Your body hair changes as well. You start to grow body hair. Menstruation comes on. Your voice will get deeper and change. And you won't sound like you anymore. You're going to sound like a different you. Some children may be prone to acne, and your personal hygiene requirements change. The way that you look after your body from a hygiene point of view is different over puberty. One of the changes I want to talk about is neurology in puberty. So what actually happens to the brain? Well, the brain rewires itself during puberty. It closes for renovation works. So you may be asking yourself, why does my child sleep so much? Why are they so tired all the time? The brain is rewiring itself. It is closed. It's closed for renovation. And why is it closed? Because that abstract conceptualization is developing. Suddenly, your child can think in brand new ways that they couldn't as they were a child. That adult brain is developing. That complex thought develops. And this can lead to children and young people being more anxious and more agitated. There is so much going on in the brain as it rewires. The next change I want to talk about is menstruation. Now, with any teenage girl, this is going to be an embarrassing subject to talk about, especially with a parent carer. But it's important to highlight that this happens to all girls and to prepare your daughter in advance by explaining what will happen during menstruation. Firstly, we need to ensure that we have all the appropriate information, all the right materials. Has your daughter seen a sanitary towel or a tampon before? We need to normalise seeing them around the house. It may be your role as a parent carer to comment on them in public bathrooms, make sure they're visible in your bathroom, because you don't want your daughter to first see a sanitary product the moment she first needs it. We want it to be a normal household item that at some point you're going to find useful. So we need to decide how and when is it best to discuss this subject. Does your daughter prefer a sit-down conversation with towels and pads and tampons? We go through each item. Do you have these conversations in the car? Oh, I think I've got a towel in my bag. Do you mind just passing it to me? Is this a conversation while out for a walk? It doesn't have to be a formal one-on-one, sit-down, face-to-face conversation. Sometimes those side-to-side conversations may work a bit better. But using those physical objects, using those materials, the sanitary towels, a tampon, a pad, something to hold and touch to get your daughter used to it. So we begin discussing and sharing information about menstruation with your daughter. I'd recommend 1 to 2 years before you anticipate the onset of menstruation. It may be that you take your child into the bathroom with you and you let them watch you handle the menstrual hygiene. Your child can practice wearing a pad and disposing of it properly. They may use a Sharpie to colour in the area in the underwear where the pad should go. So when your daughter does move to independently wearing pads, there is a physical sign in your underwear of where it should go. There are social stories that you can use for menstruation as well to support. We have an example of that coming up in a moment. And use positive and factual and scientific language about menstruation. Phrases such as the curse, code red, Aunt Sally's come to visit can instill either some fear and anxiety or confusion, especially if you have a very literal thinker. Who is Aunt Sally? What is the curse? Code red sounds scary. But using factual information, factual language, will help your daughter understand exactly what it is and desensitize, make it not a scary subject. So tampons, menstrual cups may be good choices for many people. They may be more difficult for neurodivergent daughters to use independently. So some may prefer actually to use period underwear or form of pull-ups as well, may work for some children, teenagers going through puberty. We can set a schedule for changing soiled menstrual products with your child. Does it happen on the hour? Does it happen every 2 hours? But we practice following a schedule before your first menstrual cycle. So the first time you have that new routine isn't while you're going through your first menstruation. It's a routine and a practice run that you've done many times before your first period. And we will have to inform appropriate school staff. Not everyone, but appropriate school staff. So maybe class teachers, form tutors, school nurses. If your child receives support from a learning assistant, LSA. And we do need to have these conversations to let your support team know when your child is menstruating, and also give the school guidance on how to support your child. So that may be that the school are giving reminders on how to change pads. They may have increased awareness of PMS symptoms. They may keep extra clothes at school in case of an accident. So as discussed, here's an example of a social story about menstruation. Now, you can contact the Space Family Support Team for more guidance on this. You can find plenty of these online. But here is a story about menstruation. Once I was a baby, then I was a little girl. Now I am a big girl, and later I will be a woman. Women have a menstrual cycle that comes once a month. Blood comes from your vagina, and this is so a grown-up woman will be able to have a baby if she wants. The blood flow lasts about 5 days. You need to wear a sanitary pad inside your panties so that blood does not get on your clothing. It's factual, it's straight to the point, and gives an idea of what to expect. Now next, erections and wet dreams. Again, this may be another embarrassing topic to speak to your son about, but it is something that will need to be addressed. Now, firstly, first point of call with your son is that erections are a perfectly normal function of the male body, especially males who are going through puberty. It's a normal bodily function. And although many erections are caused by sexual arousal, many seem to happen spontaneously for no particular reason during puberty. So if your son does have an erection in an odd or embarrassing situation, there's no need to worry that anything is wrong or they're sexually attracted to something that they weren't aware of. It's just their body acting naturally for their age. So that reassurance is really important. Your son might find that he has a sexy dream at night and wakes up to discover that some sperm has leaked out in the night. This is referred to as wet dreams, and it is, again, quite normal and natural. This is a topic to reassure your son that there is no reason to be guilty about having a wet dream. They're subconscious, they're not something that are controlled or manipulated. They happen while you're asleep. Now, erections and wet dreams for neurodivergent teenagers can be a source of sensory sensitivity. That anxiety due to the lack of control, it's something that's just happening to my body. And with any other teenagers, can be embarrassing and confusing. Now, much like we were preparing in advance for menstruation, prior to the onset of puberty, it's worth beginning those conversations about erections and wet dreams with your son. Again, there are lots of social stories available on the internet about erections and wet dreams. And once again, that positive language is really important. It's normal, it's not shameful, it's nothing to be embarrassed about. And you can teach strategies for dealing with spontaneous erections. You may teach a child to cover their lap with a jacket or a book or a pillow. You may encourage your child to wear jeans if sensory sensitivities allow, as they conceal erections better than athletic wear or joggers. And that sensory defensiveness is quite common with jeans because buttons and zips do require fine motor skills. So it may be worth practicing wearing jeans prior to puberty. Again, that year or so before onset. You can purchase t-shirts that are slightly longer, fall below the waist to help conceal spontaneous erections. And you may want to trial different styles of underwear. So briefs can be quite tight and cause discomfort during an erection, whereas looser boxer shorts may be a better option. But depending on your child's sensory needs, there's no right answer. It's worth trialing those out. Another change is personal hygiene. There's lots of different aspects to personal hygiene that we will go through. So body hair, your body hair appears. I think it's very important to share with our young people that shaving is not mandatory for any person. It is a complete personal choice. Beards, for some, can be quite itchy and cause sensory issues. Leg hair might be quite itchy and cause sensory issues. Pubic hair may be quite itchy for some. Your child may prefer to be clean shaven, or they may not enjoy the sensation of shaving. It's not mandatory for any person, and it is a personal choice. Now, conventional razors are sharp. They can cause cuts and injury, which can be quite off-putting to a lot of young people shaving for the first time, should they wish to. For neurodivergent teenagers, it's advised to begin with an electric razor. So an electric razor that vibrate. So it's worth practicing. Just what does it feel like when the electric razor is on? Don't go straight into shaving face, body hair, armpits, but hold an electric razor and turn it on. So get used to the vibrations and get used to the sound it makes. After that step, you can allow your child to hold the razor with the cover on and then incrementally build it up to touching the skin your child wants to shave while the razor is still covered. When your child is ready, you can remove the cover of the razor and shave. Now, in terms of things like hair removal cream and waxes, creams contain strong chemicals that can be quite harsh. They can cause burns and rashes. So it's a risk using a cream, and waxing is often very painful and is not ideal for neurodivergent teenagers. It may be your child's preference should they wish to remove body hair, and it may be worth trying those. But it is worth noting that those creams can cause some strong reactions to sensitive skin or non-sensitive skin as well. And waxing is painful. So bearing in mind your child's sensory sensitivities, we do recommend an electric razor. And also in personal hygiene, things like deodorant, suddenly a new step in your personal hygiene routine in the morning. Your child may already be independently brushing their teeth as they approach puberty. So an extension of that, it's not brand new, but an extension of that is we brush our teeth and we put deodorant on in the mornings. Lots of different types to try out. There are sprays, aerosols, there are solids, there are gels. You can get wipes as well. So wipes is a real slow step forward, as a child will likely be used to wiping their mouth if they need to after a meal, or using a hand wipe on their hands. This is a deodorant wipe for under your arms. There are lots of different deodorants to try. There are unscented deodorants as well for teenagers with, again, sensory sensitivities. Experiment with all different types and find the best fit for your child. Now, with acne, The liver helps the body remove excess hormones produced during puberty. And part of that process, this can result in acne. There are supplements that can help, omega-3s, magnesium, and B vitamins. And sometimes this step alone can help clear up acne, sometimes not. That increased oil production and hormones can cause clogged pores, leading to acne. Now, washing your face can be quite difficult for some neurodivergent teenagers with sensory issues, especially if you kind of get quite anxious about getting water on your face or in your eyes. So if your child is already used to washing with a wet wipe, you may move on to a washcloth, where you may be able just to wash a bit deeper. You can help your child practice washing their face with only water to begin with. Once a child is comfortable with their face being wet, you can add in a safe face wash if there is still a need for one. And again, you can experiment. Does my child need a washcloth, or are they okay with wipes, cleansing cloths? What is the best fit for my child? Now, something else to talk about is the urinal rule. For your sons who will be using the public toilets independently, there is an unstated code of behaviour in men's public toilets, which is instinctively universal and completely unwritten. It is one of those unwritten rules. So we need to teach our little ones that unwritten rule. Now, if you think about it, what do we do when we teach our children to wait for their turn on the slide at the park and get in the queue? If your child's primary age, before we go out to assembly, what do we do? Yep, we all line up. Where do we stand while we wait to order our food in McDonald's and Burger King? Yep, you line up. When you go into the urinals, it looks like there's a queue of urinals, but it's not. The urinals are not a queue. The rules are no pairs, no talking, no looking, no touching, and you keep your trousers up. You can look straight ahead or down. You don't touch anyone else. You don't say anything else to anyone else. And your trousers must stay up. If there is a sensory issue about having your trousers up, you can always just use a stall instead of a urinal. So one game to play with your son might be urinal bingo. In the first example here, you'd advise your son to go in urinal number 5 or number 6, no pairs. In the second row, you'd advise to go in number 6. And in the third row, perhaps you'd go in number 3, or maybe you just use a stall. Because there are unwritten rules that do need to be explained to our young people. Now, another change, friendships and those social changes. All young people need to learn age-appropriate social skills and how to interact with people around them. They all need to learn those as they become a young adult. The earlier and the more frequently these social skills are taught and practiced, the better. I think there's a bit of stigma with the term social skills. Social skills for a long time was teaching neurodivergent that if you sit still, smile, and make eye contact, that's how you get friends. And that's not what we're talking about at all. We're talking about exploring what does it mean to be a neurodivergent friend? Not a neurotypical friend. What does it mean to be a neurodivergent friend? What do those friendships look like, and what are the social changes to expect? As parent carers, we need to be aware of how we can support with these changes, or even how we can impede your teenager's social development. Are we actually getting in the way? The best place to learn these social skills is by being part of your family and being involved in its social life. Now, each child will have their own tolerance or their own desire to interact with their family. And that's fine. We're doing it on your child's level, on your child's own pace. But your child needs us as parent carers to provide as many of the messages and experiences necessary to develop this new identity as a teenager and that sense of personal competence. If there's a sense of personal competence and you feel ready to engage in those new friendships, those social changes, Think about how we can encourage your teenager to experience as much social independence as they are capable of. You don't need to push this all at once. There can be really small steps. There's an endless list of things that you can do to encourage a teenager. Some examples may be participating in social activities with friends, like we were talking about earlier, moving into that peer group rather than a family group, slowly and at their own pace. Is it independence with making your own lunch or drinks? At some point, your child will be having meal times with people who aren't their family or without adult guidance. Is it that sense of responsibility to keep their room tidy? Maybe absurd to think of a teenager keeping their room tidy, but that may be the expectation in your house, and that's that step towards social independence. Your role in this house is you are responsible for keeping that room tidy. It may be to be totally independent with personal hygiene. It may be codependent with personal hygiene. You may work towards full independence, but that may be a step that you're encouraging your teenager to do. It may be actually encouraging your child to experience privacy in their bedroom and the bathroom, as well as expecting the privacy of others. Does your child earn pocket money as a sense of responsibility, moving towards that adult responsibility? Is it walking independently and not holding hands? The list is endless. There's so many different things that you can encourage your child to do to move towards that independence, so they're not reliant on adults as they move into those new friendships and social changes. And with that complex thought process, that sense of self, that abstract thought, it's a really good time, if you haven't already, to explore neurodiversity with your teenager. Ideally, the time to start exploring neurodiversity with your child is the moment they express that they feel different to the neurotypicals. But this may be a time to reinforce that, because teenagers inherently want to fit in and are more likely to mask at puberty. All the language changes, the body language changes, the scripts that your child had that worked suddenly don't. They may suddenly be realizing those differences in themselves a lot more than they used to. That abstract thought has developed. There's the possibility of being in denial. Actually, I don't want to be different. I'm going to try even harder to fit in. Look, I'm just like everyone else, without realizing that your child is masking. So exploring neurodiversity and celebrating it is a way to reduce the risk of that happening. And this is the time to have a really open and honest conversation about neurodiversity with your teenager. There are advantages to being neurodiverse, and there are disadvantages to being neurodiverse, just the same as there are advantages and disadvantages of being neurotypical. Neurodiversity is a different form of perception. It's not worse, it's different. You may think in a different way. It doesn't mean you think in a worse way. You may learn and relate to people around you in a different way. It's not worse. Being neurodiverse can often mean that you're very honest and determined, more likely to be an expert in your field. You may notice sounds that others don't hear. You might be kind and speak your mind, not afraid to say things. You may enjoy solitude. You might be a perfectionist. You might be a reliable friend. You might be creative. You may be liked by older adults and find it easier to fit in with older friendship groups. You may need support with making new friendships. You may need support with managing your emotions and regulating your emotions, or taking advice. Maybe your handwriting is affected by your neurodiversity. Maybe you need support knowing what other people are thinking. You may not show affection in the same way as neurotypical people. There are two sides to neurodiversity, the same there is for any neurology. Neurodiversity is just a different neurology. It's not an excuse to avoid chores or consequences. I have ADHD, so I can't do the dishwasher. Yes, you can. Is it the next stage of human evolution? Really interesting conversation. And explore neurodiverse achievers. with your teenager. And I'm not saying famous neurodiverse people. We don't want to set the expectation that you have to be famous to be a successful neurodivergent. Neurodiverse achiever are the people that are happy and competent in your child's community. It's the autistic postman. It's the shopkeeper with ADHD. It's the dyslexic photographer. It's people in the community that are leading perfectly normal, happy lives, and they're neurodiverse. You don't have to be a superhero or famous or on the television in order to be a successful neurodiverse person or neurodiverse adult. There are plenty of neurodiverse achievers in our community all over the place. And normalize that, normalize being neurodiverse. Now, with those friendship and social changes, there does come some risk and vulnerability to teenagers, especially neurodiverse teenagers. And this is the time where it's important to discuss different types of relationships. What is a friendship? What is a boyfriend-girlfriend relationship? How do I build those? How do I greet and instigate a social interaction? What's the difference between a stranger and a friend? Because suddenly your child's going to be in a lot of new social situations where they will meet new friends that start off as strangers. Your child will need to practice saying no and being assertive and learn the difference between public and private. One way of doing this is to use something like this, your friendship circles, make it physical. You ask your child to come up with a set of rules on how to behave with each level. So there's you in the center. The next closest circle is often your parents. It's then siblings, if your child has any. Then your close friends and other family members. Close friends, your best friends. Then it's your other friends, then your acquaintances, and then it's your community contacts. It's the person you recognise from the post office, the person you recognise from Sainsbury's. And on the outside is the strangers. And there are subtle but different rules for each circle. So where is that person in my circle? It's unlikely that a stranger jumps straight to close friend. They may gradually move through the circles, but there are rules for different layers of relationships that need to be explored. So having a look at relationships in a bit more detail. Due to those differences in social skills, some neurodiverse teenagers may naively engage in some inappropriate or some intrusive courtship behaviours. That can include stalking in an attempt to initiate a relationship. Many neurodivergent people are solo researchers or have quite intense interests. If I apply that same sort of knowledge that I do to the Cold War or to the taxonomy of South American beetles, if I apply that same sort of approach to a potential partner, that can come across as too much, invasive, or in some cases stalking. There is no malicious attempt there at all, but without understanding the impact on someone else and having a conversation about the impact on someone else, that can be misinterpreted by others. Now, friendship skills need to be developed before you can have more intimate relationships, because it's an extension of a friendship. So again, it's not brand new parenting. I've already taught my child about, what makes someone a good friend. How do I recognize if someone's being a good friend to me or not? How do I reciprocate that? Teaching about relationships and more intimate relationships is an extension of that. Teaching your child about sexual relationships should help make sense of the world around them. They become more informed and less vulnerable. What it doesn't do is encourage sexual relationships. Talking about sexual relationships does not encourage them. It makes your child less vulnerable. It's also worth noting that some neurodiverse girls may use their own sexuality for social credit. things like TikTok, social media can glorify use of sexuality. And if that's the role models that our children have, they may be more likely to lean towards those, especially neurodiverse girls who may be in a more risky and vulnerable position. So the issue of sexuality and sexual relationships should be taught within a value framework that encourages safe, healthy, and happy sexual relationships. So what are the strategies for that? Again, establishing rules for relationships and rules for friendships. Provide accurate information on all aspects of a relationship. So that's including things like an appropriate timescale and age in relation to sexual relationships, while remembering the law. So the concept of consent and permission in relation to all touch, including kissing. You may not just go and hug a friend without asking. You may not just go in and sit next to them and put your arm around them. There needs to be consent for that with a friendship. When we extend that into a relationship, that consent is there for things like kissing and hugging. Your teenager will need to recognize feelings and emotions within a partner. This will help with how relationships may shift and change. This may mean that your child may have to get a script and ask if they're not intuitively picking up on someone else's emotions. It may be that they have a scripted phrase that they use to check in on a partner. But recognizing and empathizing and understanding someone else's feelings is an important part of that next stage of a relationship and going past a friendship. So we need to provide encouragement and opportunities to make acquaintances and friends where appropriate. Now, on the topic of sexualized behavior, neurodiverse people can, will, and have been arrested for what was seen as inappropriate sexualized behavior. And once this happens, they can be labelled as dangerous, even though it was an innocent mistake with absolutely no malice. This is why talking about sexualized behavior in sexual relationships is important, because you are informing your child. Informed parents inform informed children. More informed is less vulnerable. It's much easier to have these conversations and modify sexual behavior in a child than it is to change those same behaviors in an adult. So getting in early in those early stages of puberty and setting those boundaries is setting your child up for adult life. Made to explain to your child that touching other people without permission is completely unacceptable behavior. You may need to utilize prompts and approaches. So maybe social stories that help reinforce this. It may be elements of drama therapy. It may be drawing pictures. But that's a topic that needs to be explored. Touch needs to come with consent. You need to give your child time to talk about how they feel on a daily or weekly basis, a regular basis. And when I say that, talking about how you feel, it's talking about your sexual urges and developing healthy ways to either satisfy that or dispel them. This can help your child get out of a problematic situation. And again, this may be really uncomfortable to have a weekly or daily check-in about this sort of conversation, but it needs to be scheduled in. Talk to your child about what is good touch and what is bad touch, and help discern the difference between what's appropriate and what's not appropriate in a public and a private situation. Which takes us on to the topic of masturbation. Now, if you have a child with special educational needs, a disability, neurodiversity, you will have to talk about masturbation. It has to be a hands-off approach, literally, because you cannot provide a role model. You can't show how to masturbate the same way that you can show how to change a tampon or show how to change your bed sheets. Now, the frequency of masturbation usually decreases naturally after adolescence as your child goes into that young adulthood. but it is possible, and it is something to consider. We do need to provide structure and boundaries to the situation of masturbation. It is a topic you're going to have to talk about and set boundaries with your child. This may be an embarrassing conversation to have at first, but it does reduce embarrassment in the long run. It also reduces the risk of abuse. So firstly, we decide upon where is the appropriate location for your teenager to masturbate. Is it the bathroom? Is it the bedroom? It's never in public. It is never in a shared area of the house. It's never outside of the house. And it needs to be more specific than on your own. That's something you do on your own, because you can be on your own in the living room with the windows open. It can be at the park because no one else is at the park. So on your own isn't specific enough. It needs to be in a certain room of the house. In that room, you will need to provide relevant items, so tissues, things to clean up. And it's important to remember the possibility of any objects, things like cuddly toys, being associated with the act of masturbation in the same way as feelings and emotions are. So it may be worth removing any objects that your child may have an association with. If it's always in the bedroom and there's always a certain cuddly toy on the bed, there may be a visual link that's made. Whenever I see that teddy, I'm masturbating. So it's worth clearing that and having those clear boundaries of what the room looks like. Agree with your child what would be classed as a reason for them to go into the location and how frequently. And provide a means of indicating when they should relocate. Is it a hand signal? Is it a set phrase? If your child does need to go into that quiet place on their own. That leads us on to our closing thoughts. Puberty will happen, whether we like it or not, whether we're ready or not. Your child will need to be taught new social rules because the social rules change. Your child needs to be informed about that. Don't make any assumptions about your child's prior knowledge. It's not brand new parenting, but it is an extension of what your child already knows and the parenting that we have already done. More informed is less vulnerable. Bear that in mind if you're having a difficult or embarrassing conversation. It may be hard in the moment. You're making your child more informed and therefore less vulnerable. Thank you so much for watching. Could I please ask you to follow the link on the screen or scan the QR code to fill out a short feedback form on this webinar. Thank you so much for watching. Goodbye.